Hi, Rik Deitsch, my favorite biochemist. And oh my goodness, one of the things I love about life is just being able to have something to share with other people. I think being involved with Aveni, it just fits into what we're all looking for. We all want purpose, and just being able to give other people something. Our greatest joy is to give other people joy, and we're all looking for being more healthy, more wealthy, and being part of a club like this is just so amazing. And what's really fun is being part of something new that nobody's ever heard of, the novelty of all of that. And yet what we have is a really unique situation. Nobody's heard of us. And yet our roots go deep back 20, 30 years. And specifically, I'd like to share something that was really amazing. But before we do that, I want to give you all, just let you know about this opportunity to meet some of the corporate people, Neil and others, that is going to be Monday, this coming Monday at 6 p.m. Pacific time. You can go to Avini Health Training and definitely make a note of Avini Health Training. All things Avini are all just everything's in one place right there. But you can look up the Zoom number. It's going to be great. I'll be on that as well. But oh my goodness, I am so excited. This is my all-time favorite company of about 50 years of doing this. And I think about before Aveni, I was with one company for 30 years. And we had some amazing health technologies, and of those 30 years, I look back and I think, okay, there were some amazing things that happened, but what was perhaps the most exciting, and I think probably just not long after the turn of the century, we were met with a guy by the name of Patrick Millsap of Imaginetics, and he introduced this product that we called Joint. And that's where I first heard the word acetyl myristoyate. And it's fun being in these type of companies because like in the early 80s, I'd never heard of CoQ10 before, and that was introduced with the company I was with. Nobody knew about that, and CoQ10 is a big deal right now. I believe acetyl myristoyate, most people have not heard of it, but it's going to really get some traction because of what's going on. But anyway, back then, Patrick Millsap, Imaginetics, they talked about this proprietary, clinically proven complex based on that. And I met this lady who, in her early life, she was the second fastest runner in her class in the first grade, just really vivacious and everything. But when she turned 9 years old, she got really sick, and that left her with what we call youth onset RA, rheumatoid arthritis. And by the time she was a teenager, she was relegated to a wheelchair, and they told her she would never walk. She heard about this product that had acetyl myristoyate, and she had this idea, some is good, more is better, too much is just right. And she just wanted an opportunity, and so she took, I remember, 18 capsules a day of this stuff. And anyway, in a couple of months, she was out of her wheelchair. And I've got her on YouTube. Carrie Roundy, goes way back, but I'm interviewing her. And she's standing there talking about selling her wheelchair and her lift van. And I said, tell me a little bit more. In fact, show me. And she's running and jumping. And it was just transformational. And she was the poster girl. She was she'd be on the stage at her meetings and everything. And it was wonderful. Until it wasn't. A couple of years later, we were told that we'd had an improved formula, a different vendor, and with her, it didn't work anymore, to the point that she actually quit buying it, and we lost touch, and then she was just in a lot of hurt, and she was still able to keep some of those gains, like she could still stand, but just hurt a lot. Let's go back to the last convention we had in August, and here's Rik Deitsch, and he's talking about Imaginetics. I'm just thinking, I was on the other side of that show with another company, but you knew all about that. And I just imagined my delight when you talked about that particular company and then adding some other trademark proven clinically stuff. And then what was really amazing is you launched that Friday morning, and then you had a Q&A Saturday afternoon, barely a day. And there was people not just talking about it and asking questions, but giving testimonials. Amazing testimonials. Guess who I called when I got back home? Carrie Roundy, and told her about this stuff. And it was really sad because she says, I'm not really happy being here, and I'm ready to go because she hurt so bad. And then, of course, she was very interested when she heard about the Imaginetics story and the new formula, got on it, and in just a very short time, all of a sudden, She's thinking, hey, I feel pretty good. I think I'm ready to hang around more. She was able to kneel. She felt like being a prayer warrior, but she always wanted to be able to kneel when she did that. Now she can. Her knees are working better. And it's just, wow, to have just the most wonderful products and being able to share them. And it's fun to say, have you ever heard of acetyl myristoyate? No one has. And of course, every day I'm saying, hey, have you ever heard of clinoptilolite? Let alone micronized and activated. And we've got this really cool stuff that everybody needs. And just a moment. And I got to mention, you're probably going to have something in barely a month from now, Valentine's Day. I'm coming to the convention. I recommend everybody else do. And we're going to just be enlightened and be able to come back with the vision that everybody needs. And it's fun to be excited about something. And Rik, thank you so much. And all of corporate Aveni and all of you guys out in the field, we've got something to share. And oh, goodness, it's just getting better. And for me, 2026, it's going to be my best year ever. And come with us. We've got a mighty work to do. Rik, you've been around, you've done billions of dollars in product development for other people, and now you're doing it for yourself. And this is our biggest ride ever for all of us, and the best is yet to come. Talk to us about all these wonderful things.
That's a long tee up, but yeah, listen, it's what you said is true. A lot of this stuff has been around for some time, improved over time. But one of my favorite quotes is Sir Isaac Newton, who was lauded as the most brilliant person in the world at the time. And he said, if I've seen further than others, it's because I've stood on the shoulders of giants. We have all this research that's already been done. Cetyl research goes back to the 1970s, and they perfected it. By the time I got it, it was 1999. I looked at the first research, and we launched the product with the company I was with in 2000. And it was end of 99, 2000. And we thought we had the exclusivity. And then I looked and saw other companies were launching it. I was a little upset. And for people that don't know how it's spelled, cetyl it's MYR. So it's myristoyate. It's myristoleic acid, which is a long chain fatty acid. And I actually trademarked the name Miriflex, Myriflex, because it's like a miracle. It's cetyl it improves flexibility. And I thought I was a marketing genius. And the marketing people didn't like it. So they didn't use my trademark. I thought it was a great name. At that point, they said, Rik, stick to science, we'll stick to marketing. And they made me feel stupid. And I got to tell you, I still think it's a good name, Miraflex. I might use that
It
for
is.
something. But yeah, so when you look at the dietary supplement world and you look at Aveni, we're constantly thinking, what is missing from our product line? What can we launch that will help our distributors, but certainly everybody? Because we want to have products that everybody can use. Everyone's going to be able to use it. When they hear about them, they want them, and this is the only place to get them. That's the key. So we're never going to have generic products. We're not going to have, like people say, what about a multivitamin? So I did want to have some form of multivitamin, some sort of basic nutrition. So we put it into our cutting edge meal replacement protein shake. So it's a different formulation that allows us to get our multivitamin, but it's the blend of proteins, the enzymes that are in there, along with the mid-chain triglycerides. They're going to promote healthier weight loss and weight management. So there's ways that we can tweak that. So the last conference, last summit, we talked about joint support. We said, where are we missing? It's bone and joint. And so I said, what can we do? I did want to try to address osteopenia, osteoporosis, and bones, but that's going to take a large dose of something like 1,000 milligrams, 1,500 milligrams of calcium, along with the resorption elements. I actually suggested a cookie, like a calcium cookie, but our current manufacturing, we can't make cookies. And Neil Roth, the CEO, said he only wants products that we can make ourselves. We don't want to go outside. We want to have complete control, be fully vertically integrated. And so the products we make are the ones that we make ourselves. And we have liquid filling lines, capsule filling lines, tube filling lines, gel filling lines. We're adding soft gels and gummies in the next couple of months as we expand from 18,000 square feet to 33,000 square feet of manufacturing offices, production, and shipping. We know what we can and can't make. So in the last iteration, I said, okay, I can make something different and cutting edge in joint support. And it's not just the stuff that's been around forever. There's new research and new ingredients that no one's ever heard about. Most of this work is being done by biotechnology companies, pharmaceutical and biotechnology companies, but these are on natural products. And all this led to this concept we have of plus motion. So if you just take a step back, all of us eventually will have joint problems. And that's because we're turning our cells over all the time. We're making new cells. Every 3 months or so, you've flipped over almost every cell in your body. We constantly are making cartilage from type 2 collagen, the cartilage, the cushioning between our joints. The problem is our body is constantly breaking down that cartilage. Eventually, as we get older, we break it down faster than we can build it. And so that leads to supplementation to build cartilage, to build that cushioning. And the big thing that came out in our lifetimes was glucosamine. In the early 90s, Dr. Theodosakis wrote the book, The Arthritis Cure, and it was all about how glucosamine can force us to build new cartilage. And everybody started taking chondroitin and glucosamine. That was a big thing. I was actually on the team that launched OsteoBiflex, which for a long time was the biggest selling dietary supplement in the world. It was crazy, but it does help you build cartilage. The problem is you're still breaking down the cartilage. And so it takes a long time to see a benefit. I remember the products we launched, people would call me after a few weeks or a month and say, I'm taking your product, it's not helping. I'm taking your product, I'm using it as exactly as you tell me, it's not helping me. And so it took you 60 years to get arthritis. Could you give us 3 to 6 months to try to fix it? And so that was my line, give it time. But that always, we're a fast society. We want immediate results, immediate benefits, or at least as close to immediate as possible. We also, I'll take a step back, in this field, if you could have tangible benefits or tangible results, that's the magic bullet. We have so many products that help improve our health, improve our bodies. We can see it in blood work, in urine analysis. We can see it in MRIs. But for the most part, it's not visible to other people or even seen by yourself for some time. We have a fiber product that's clinically proven to lower cholesterol, but no one stops you in the street and says your cholesterol looks great today. And so if you can have tangible benefit where you feel better and look better, that's great for the business because now you've brought it into the real world and other people are going to come to you and say, why do you look so good? Why you got a spring in your step? You look fabulous. You're moving better. You seem younger. And so having a product for joint support where people are walking straighter, feeling better, looking better, being more active, that's huge, not just in their personal health, the health of their family and friends, but in the business of Avini Health. We have something different than everybody else that works so fast. And so all of this research, all this technology went into where we said, okay, what can we do for joints that no one's ever done before? So it starts with exactly what we've had before. We have glucosamine. Now I've always used glucosamine HCl. A lot of people use glucosamine sulfate. You'll see glucosamine SO4. Glucosamine sulfate is cheaper to make. The original research was on glucosamine sulfate, but be clear, that's just the salt of glucosamine. The active ingredient is the glucosamine. Now, if you look at glucosamine sulfate versus glucosamine HCl, only 63% of glucosamine sulfate is actually glucosamine. In glucosamine HCl, it's 83%. You're getting a lot more glucosamine for that molecule, so a lot more bang for your buck. So you can take less of it to have a clinical dose. So instead of 1,500 milligrams, we can take even less than 1,200 milligrams to get the same clinical dose of glucosamine. So that gives us a little more room, it's a little more bioavailable, and of course you get more bang for your buck. So that's the glucosamine. Now, glucosamine does support the production of cartilage in your body, does help your body make new cartilage. It helps push that along. That's been well established. Then we'll look at MSM. So MSM is a sulfur donor and a methylator. So MSM has long been used for joint support, for increasing flexibility in the joint, increasing lubrication in the joint, and helping build new cartilage. So that's another ingredient that everyone knows about. And then we have hyaluronic acid, HA. Hyaluronic acid is water attracting. It goes into the joint and pulls water into the joint. That makes it fluffier. It makes it bigger. It hydrates the joint. And so hyaluronic acid has been used for years in many products. We're not the inventor of hyaluronic acid. In fact, if people get injections into their joint, to the knees or shoulder, it's either cortisone, which is a steroid to prevent inflammation, or it's hyaluronic acid to try and fluff up that joint. So a lot of people get hyaluronic acid injections. So we put that in it as well. So far, we're using things that people are really familiar with. Then we'll look at cetyl myristoyate, which is branded as Celadrin. Cetyl myristoyate has been around. Research goes back to the 1970s. And the concept with cetyl myristoyate is something called negative biofeedback. When your body wants to create inflammation, it's an inflammatory response due to your immune system. Your immune system makes compounds called leukotrienes and prostaglandins. Leukotrienes and prostaglandins are these long chain fats that tell your body to make all these inflammatory products to create inflammation because it's a good thing. The body thinks inflammation is good because it's trying to stop you from moving a joint that's damaged. Okay, so you hurt yourself, you got a damaged joint, make inflammation, stop moving, you're hurting yourself. Now, for us, we're not just cavemen. We have it's the technology that can heal joints, that can heal bones. So we don't just need our body to create a cast. We'll put a cast on it. So we don't want the inflammation. So even though our bodies perceive inflammation as a good thing, it has negative connotations in the body. It makes us not be able to move. It stiffens us up. And inflammatory products can even cause heart disease and increased risk for heart disease and vascular dysfunction. And so we want to try to dial down inflammation as much as possible, even as our body is dialing it up. Acetylmyristoyl is interesting because it's a long chain fatty compound that looks almost exactly like leukotrienes and prostaglandins, and it confuses the body. When you take acetylmyristoyl, when you take the Celadrin, the body thinks it's already made leukotrienes and prostaglandins, so it stops making them. That's why it's called negative biofeedback. It teaches the body not to make something. And so all those inflammatory products are not being made anymore. Inflammation dials down and then goes away as long as you're taking the product. So it's a natural anti-inflammatory that works differently than every other anti-inflammatory product. So if you take aspirin or NSAIDs, those are called COX-1 inhibitors, cyclooxygenase inhibitors, and they stop part of the inflammatory cascade of making leukotrienes and prostaglandins, but only part of it. So you make a little less inflammatory compounds when you're taking aspirin or Advil. It's a completely different mechanism. So if you look at the different and then you have something like the plus relief. The plus relief is anti-inflammatory, but that's anti-inflammatory because it affects the white blood cells directly that produce the inflammatory compounds. So it never produces leukotrienes and prostaglandins because we're dialing that down. So these are all different ways to prevent inflammation in the body. And when you attack a mechanism, you attack something for different mechanisms, you have synergistic benefit. So taking the plus motion with the plus relief is fantastic. The plus relief, it takes away pain and inflammation, while the plus motion is reducing inflammation and building joints and cartilage and building tendons. And I'll talk about that in a minute. So we start with the stuff we know. We have the glucosamine, we have the hyaluronic acid, we have the MSM. Now we have the Celadrin, the acetylmyristoyl, that's naturally anti-inflammatory, but that long chain fat is also a component in the production of synovial fluid. Synovial fluid is the lubricating fluid in the joints. It's when the Tin Man in Wizard of Oz says, oil can, oil can. He's looking for oil because he's all rusted up. So our oil in our joints is synovial fluid, and the Celadrin, acetylmyristoyl, helps us make more of that. So not only are we reducing the inflammation, we're lubricating the joints so they move better. And I talk about the word of the day I used at conference was crepitus. Crepitus, Crepitus, crepitus. Crepitus is that Rice Krispie crackling sound you get in your joints, especially in the morning when you first wake up and you start moving around and you hear pop crack. So that's caused by cavitation. Basically, as the joint moves, it gets air bubbles inside the joint through the movement and lack of synovial fluid. And those little air bubbles start to crack when you move. You're cracking or popping joints. One of the first things you're going to see with this product is less crepitus. You're not going to hear that crackling, that joint, that Rice Krispie sound, because the synovial fluid is taking up that space and preventing the cavitation that leads to those air bubbles. So very cool stuff. All right, so some other ingredients that we've added that nobody's really used before because it's new technology. So first we have the collagen N2. The collagen N2 is a bioidentical type 2 collagen. Now it does come from chicken sternum. It comes from the sternum of chicken, but it looks almost exactly identical to human type 2 collagen. And the point of that is not to replace that collagen to make the cartilage. It's to teach the body what our cartilage looks like to protect it. So in the intestinal tract, you have a section called Peyer's patch. Peyer's patch, it's almost like a lot of bureaucrats working in an office, and they decide what is good and what is bad. And Peyer's patch takes something and says, this is good, leave it alone. This is bad, get rid of it. Okay? It codes those compounds. So when the collagen N2, when that bioidentical cartilage hits the Peyer's patch, it teaches the immune system not to attack it. It teaches the body to leave it alone. And remember, I told you we break down cartilage faster than we can make it, which leads to osteoarthritis over time. Even taking glucosamine or things that build cartilage can't outpace that. It takes a long time to try to build that cartilage against us breaking it down. But when you take the collagen N2, which is a very small dose, it's just to teach the body what to do, that stops us from breaking down our cartilage. So now we're not breaking it down anymore and we're building new cartilage. So this works so much faster than any other product ever created because we're not working against, we're not, it's like the building's on fire on one side and we're building the building on the other side. And we're trying to outpace the destruction of the building. Now we're stopping the fire. We're stopping the breakdown of the building while we're building it up. So I don't know if that analogy works for you. I'm trying to find out the perfect analogy for this. But the fact that we're not breaking down cartilage while we're building new cartilage is a huge step in the treatment of joint distress and prevention of osteoarthritis. So the collagen N2 is cutting edge. It's new. It's got tons of research behind it, and not a lot of people are using it. There was a company that was using it in a form called BioCell, but they had to take so much other stuff to make it work. Ours is very simplistic. It's very easy to take twice a day to get the same benefit that we've seen in clinical research. So that's new. The same company that developed the collagen N2, they're masters of joint support. They created another compound called tendaxion. And this is cutting edge. This is something that's never been seen before. It's clinically proven to rebuild tendons, the connective tissue of our joints. Now, we've been told our whole lives that between tendons and ligaments, they tear, they whatever, they can heal, but they'll heal with scar tissue. So you're always going to have loss of range of motion and pain after you have a tear in your tendons. Or you need surgery, rotator cuff, you got to get the surgery to reattach it. And even then, you'll have scar tissue and loss of range of motion. So this is the first time ever in the history of medicine that we found something that rebuilds the tendon. And I showed pictures in my slides that shows before and after how the tendons all scar tissue and all bundled up, like fibers bundled up. And then over time, it straightens out, lengthens out, and you have the striations perfectly in parallel with each other as the tendon rebuilds it. It's really fantastic. And there is, like I said, nothing like this on the planet. It's new cutting edge research. I can't find another American product. There's a couple in Europe now because research was done in Spain, but I've not found another American product now that's utilizing tendaxion. And so we have joint support and tendon support, and we have it right away. Like I said, Plus Motion is a game changer when we're dealing with osteoarthritis, when we're dealing with joint support, when we're dealing with damaged tendons. It's going to rebuild that cartilage. It's going to hydrate the joint. It's going to produce synovial fluid and lubrication and make the joints more flexible. And it's going to line up and heal those tendons. And my own personal story, when about 15 years ago, I was in I don't want to say motorcycle accident. I was stupid. I was on a gravel driveway, gravel parking lot. I was picking my son up at soccer practice, and I gunned my motorcycle, and the wheels went right out from under me. And I came down hard. And I will tell you this, not to say I'm super dad or whatever, but I know I twisted my body to try to protect my son who was on the back of the motorcycle. So I twisted under him to stop him from hitting the ground. And I landed on my left shoulder really hard. And I completely screwed up my left shoulder. I did get a couple of shots of hyaluronic acid and cortisone at the time because it was so messed up. But they tell me there's nothing I can do. It actually would require surgery to be any better. And so before the Plus Motion, if people have seen me at conferences, I go like this, then I rotate around to try to get my shoulder up because of where the damage is. But now I have full range of motion of my shoulder. I've not been able to do this in forever, to be able to pull my shoulder up and around. And I can still feel a little bit of where that is, but it's getting better every day. So I'm a really good example of just increased range of motion from the tendaxion, and that's from tendons. That's not from anything else. And of course, I just turned 58. I'm getting to that age where the osteoarthritis is starting to kick in. Heberden nodes on my hands, especially because I play guitar. So I'm starting to see the swelling of the joints in my hands. Very prevalent in guitar players. But since I started taking the Plus Motion, it gets better and better and better. I'm taking pictures to show the knuckles getting better and improving over time. It's very exciting stuff that it's not a lot of times I make a product and I see the benefits personally. So it's really great that I can see the benefits right away. And like you said, Dave, at the conference, at the summit, we launched on a Friday and people bought it. And by Saturday, by the next day, we had testimonials. within 24 hours. People were sleeping better, they felt better, they have more flexible joints and more reactive joints. And that's primarily because of the celadrin, the acetylmyristolate that lubricates the joint, prevents inflammation right away. But yeah, people who take the product get immediate benefit.
That's fantastic. In my mind, I'm thinking WD-40 for your body.
Yeah, let's not do that. They'll sue us. We say lubrication for our body.
Yeah.
You're right. Like WD-40, universal lubricant.
Yeah.
Yeah,
My goodness, have you got time for a few questions or?
absolutely. Yeah.
Okay.
And I will say this, I said this on the CEO call last Tuesday. I'm really excited about the summit. I know we're doing it in Las Vegas again, but it's still to be face to face with everyone to answer questions. We are launching new products and new technologies. We're talking about new research. We're talking about scaling up manufacturing, what we're going to be doing with that soft gel and gummy technology that we're going to bring in. So if anyone has the ability to get to Las Vegas on Valentine's weekend, you got to be there. You got to come. There's nothing like going to a summit. It's really the shot everybody needs to grow their business, to share these products. Every time someone goes to a summit, they come out roaring. They come out just ready to go. And if you have the ability to get there, you got to get there. All right.
Amen.
Okay, so I saw we had 132 people. Anyone have any questions? You can type them into the Q&A.
Yeah, I think everybody's just dazzled thinking, yeah, we learn new things all the time. The Pyres patches, I'd never heard of that before in all my life until this
Oh,
product came
really?
along.
Yeah, you start learning about
That's
parts
a
of your
big
body.
deal.
Yeah, no, the Pires patches. And it's funny because you learn it in digestive health, but it's really immunology. It tells the body what antibodies to make and not make, what to target and not target. I like my analogy of bureaucrats. So these people just coding things. What's good, what's bad. It's like data entry in your body. So someone asked about myositis ossificans. Listen, there's a lot of myositis, which is inflammation of the muscles. Certainly, this will help with flexibility. Okay, but depending on the cause of the myositis, some is genetic, some is caused by trauma. I know someone who did dermatomyositis, where the muscles get almost like rocks. You become almost like a statue. I have ways that gets treated. For example, pool exercise is fantastic for that. That might be for myositis ossificans as well, because your muscles start to tighten up. So if you can get into a swimming pool and exercise in a swimming pool, that helps move the muscles. It helps stretch them out. So pool exercises are fabulous for that. But the plus motion is going to help with the rebuilding the cartilage. So it's going to help with flexibility. It's going to help with range of motion, and that'll help with moving the muscles as well. Oh, Tim, go Indiana. Listen, if you want to talk football, I'm very proud of Indiana. This is the first time in forever that Indiana's gotten this far, but they're a team of sixth and seventh year seniors. It's not going to be a dynasty, even if they do win. And Miami is the underdog in this game. But Miami's a young team. Look at a guy like Malachi Tony. He's 18 years old. He left high school early to come play college football. So this Miami could be a dynasty. So even if we don't win the national championship this year, we come in number two, we're going to get there again next year and the year after that and the year after that. So I'm very proud of the team Miami's put together, especially of so many young players. Okay, but listen, I love Indiana. They're undefeated. I almost feel bad if Miami wins because it'll ruin their undefeated season. It would be nice the undefeated season. But I am a Miami fan and I got to go with my Canes. Okay. Is there a benefit taking more Avini Plus Motion than recommended if they're a larger person? So it's not about the size of the person, but like most of our products, you can take a little more, especially if you have a diagnosed medical condition. So we're saying two twice a day. If you want to take three twice a day, two, three times a day, and add one more dose, that's certainly going to be beneficial, especially if you have advanced joint distress. But all the clinical research, the two twice a day is matches the clinical research where people have seen joint recovery, improvement of range of motion, improvement of tendon rebuilding. So it's that dose. But I probably wouldn't take more than two more a day. So two, three times a day or three twice a day. Let's see. A hockey player, 16 years old. Wow. Yeah. Someone's asking about torn bicep. So torn bicep is not a tendon. That's actually the muscle. That's a myositis. In that case, certainly it's going to be physical therapy. But our meal replacement protein shake would help as well, because not only does it supply the protein that helps rebuild the muscle, it has the enzyme aminogen that makes sure that we spare lean muscle mass. So one of the problems with, especially when you're trying to lose weight, is the body will burn lean muscle mass as an energy source. And so you want to try to prevent that loss. That's called catabolism, is the loss of lean muscle. So the aminogen blend is anti-catabolic. It prevents catabolism. It prevents the breakdown of that lean muscle mass. And so it can help you lay down new muscle mass. So I would highly recommend the guy with the torn bicep. Of course, Plus Motion will help with range of motion and pain and inflammation. The Plus Relief will help with the pain, but the meal replacement protein shake will help build new protein, build new muscle. Best and fastest result, cost is not an issue. Gilda, it depends on what your issue is. So if you're just talking about osteoarthritis or rheumatoid arthritis, then it's going to be the Plus Motion as recommended, or like I said, add 2 more capsules a day, and then the Plus Relief. The Plus Relief is a natural anti-inflammatory and analgesic. It takes away pain and inflammation in pretty much everybody. It's very easy to use. And by taking away that pain and inflammation, improves circulation, improves utilization of all the other products. Will this session be on the Avini app? I don't know, Dave, how you handle your calls.
I'll make it available if Avini wants to put it on. Absolutely.
Okay, someone's asking about fibromyalgia. Now, I always hate to say this, but fibromyalgia is not really a thing. Fibromyalgia is what they call a basket diagnosis. A bunch of rheumatologists got together in the mid 90s and they put together a bunch of symptoms from their patients. And doctors hate not being able to diagnose, and patients hate not getting a diagnosis. So they said if anyone exhibits 9 of these 23 symptoms, we're going to call it fibromyalgia. So that's what we call it, a basket diagnosis. Now, one of the things we found over the years is almost every single fibromyalgia patient has a magnesium deficiency. So magnesium is necessary for calcium utilization. So people think, oh, they're taking calcium, they're making sure they get calcium, they're not getting their magnesium to be able to utilize the calcium. And so there are lots of products out there for fibromyalgia that are really just absorbable forms of magnesium. There was a product for years called Fibromel, that all it was magnesium and malic acid, magnesium malate, and it worked wonders. So I do recommend that anybody that has fibromyalgia can certainly use the Plus Motion for joint health and joint support. They can use the Plus Relief for pain and inflammation, but they should have a good magnesium source, magnesium malate, magnesium citrate, a good acidic form of magnesium, and try to get 400 milligrams a day, 400 to 500 milligrams a day. And that really turns around pretty much everything in fibromyalgia patients. This helps with lymph nodes all over the legs and bodies that hurt. I take them all, of course. Okay, so if you have inflamed lymph nodes, this will help with the inflammation, but there could be an issue where you have a lymphocytis, you could have something else. So make sure that you see a doctor to make sure you don't have something more serious. There's even lymphatic cancers that can cause that. So you want to make sure information is everything. I know a lot of people don't like to go to doctors, they're afraid of doctors, but knowledge is power. It's better to get a diagnosis, find out what's going on, and then we can find the best way to deal with it. Depending on what's going on, we can deal with it. Now, certainly the lymphatic system is our detox system. So Cell Defender is amazing for lymphatic drainage and moving things along and capturing things in the lymph. So if you're on all the products, then great. Make sure you're taking the detox dose of the Cell Defender, 10 drops 4 times a day. That'll help with the lymphatic system. And then, of course, if you have any pain or inflammation, that's the Plus Motion, the Plus Relief. Let's see. I started Plus Motion, then a few weeks, my own shoulder issue came back, then it went away. I thought it was fixing it properly, it was under construction. I don't know. I feel it now. I don't feel that shoulder at all. Does that make sense? Is that possible? Paige, I got to talk to you about that because we got to see what exactly is happening. The Plus Motion is going to rebuild the cartilage and rebuild the tendons. If you have different sensations going on and off, you could have a pinched nerve, which is a whole different thing. And that pinched nerve doesn't necessarily have to be in your shoulder. A lot of times you have a pinched cranial nerve, like the accessory nerve in the neck. And so you feel it in your shoulder, but the issue is not your shoulder, it's your neck. So I can talk to you about this separately and try to find out exactly what's going on. I do recommend when people have that weird pain, it doesn't seem like it's localized, it could be upstream. I use the Plus Relief topical gel, and it never hurts to rub it on the back of your neck where all your cranial nerves come out. You have 12 different cranial nerves that innervate your whole body. So it's never a bad idea to try to reduce inflammation on the cranial nerves, and that kind of helps everything in the body. So a little of the Plus Relief in the back of the neck might be the trick to dealing with that neurologic issue with your shoulder. Okay. What about a person with aortic stenosis? That's different. Okay. So you have a hardening of the aorta. That is a cardiovascular problem. We could talk about plus cardio care. The plus cardio care. First of all, cell defender for everything. Everyone knows a cleaner, healthier body fixes itself. So get rid of the trash, get rid of the stuff that's inhibiting metabolic function. Your body will start to work better. But the plus cardio care is a revolution as well. It's something that helps the entire cardiovascular system. So there's components that make the heart a stronger pump. So the heart as a physical pump gets stronger with the components of the plus cardio care. It has components that help with rate and rhythm. It helps components that help relax or make more supple the larger blood vessels around the heart. So that deals with arteriosclerosis. It's got components to help clear out the trash in the arteries. So that's for atherosclerosis. And it helps with the surface circulation. So circulation all over your body. That's things like the brivascapine and the L-arginine with the citrulline that produce nitric oxide that help with circulation all over your body. So yeah, if you are diagnosed with aortic stenosis, you definitely need to be on the cell defender and on the plus cardio care. Does the plus motion build up in the body so you can reduce dose at some point? So the components don't build up in the body, but the effects build up in your body. So the whole idea is to build cartilage. And yes, with the recommended dose for all the clinical research is the 2 capsules twice a day. That's the recommended dose. If you have severe issues, you want to take more, as I said earlier in the call, I take 2, 3 times a day or 3 twice a day. And you can do that just for a few months and then lower it to the recommended dose. But anybody, I would say everybody, because everybody eventually gets osteoarthritis. If you're over the age of 45, you should be taking this as a daily supplement 2 twice a day. Will ligaments respond as well as tendons? Yes and no. So some of the fibrous compounds are going to help. It's going to help lay out those fibrous compounds, but ligaments have different connections. So the tendaxine is specifically studied for tendons, not for ligaments, but they say it does aid in ligament health, but doesn't rebuild the ligaments the same way it rebuilds the tendons. Faced with knee replacement plus motion assistant recovery? Absolutely. First of all, if you're having knee replacement, if anyone does any joint replacement, I cannot stress enough how important rehab is. So many people get a replacement and say, okay, I got it replaced and they're done. No, if you're not committed to doing the rehab, to doing the exercise necessary to preserve range of motion, don't even bother getting the surgery. Don't get it done. And it is a painful process going through the rehab, but you have to be committed to that because once you get that replacement joint, if you don't make sure your body knows it's a replacement joint, knows what it's supposed to do, work around it to get that range of motion in that joint, then you could be worse off after the surgery than you were before. So make sure you're dedicated to the rehab. And then with that, the plus motion is going to help with the cushioning around the joint. Even though it's an artificial joint, there's still cushioning, there's still space, there's still synovial fluid production. So plus motion will help, as well as the plus relief for pain and inflammation. I use products every day. I have neuropathy in my feet, and plus pain relief plus works because I don't want to use gabapentin. I use the plus motion twice a day. Is there anything else you can think of that I can add? Christy, I can only ask you what the cause of neuropathy is. The number one cause of neuropathy in the United States is diabetic neuropathy. So if the neuropathy was caused by diabetes, then absolutely make sure that you're maintaining healthy blood sugar levels, and that would be the plus fiber. The plus fiber is clinically proven to lower HbA1c, to reduce postprandial hyperglycemia, and to help stabilize blood sugar levels. So that would be that. If it's not caused by diabetes, then you're doing everything right. The plus motion, the plus relief are going to be wonderful. But I like to find out what the underlying cause was. So most neuropathies, like I said, are either diabetic neuropathy, they're genetic, or they're a side effect from drugs. For example, platinum-based chemotherapies always cause peripheral neuropathy. So it's nice to try and figure out what caused it to try and deal with it and maybe reverse it. Okay. Have someone has symptoms like ALS, but they have not been able to diagnose. Okay, Robin, a diagnosis is everything. ALS, the problem is symptoms of ALS are simply symptoms of neuritis, so symptoms of inflammation of the nerves. And that could be multiple sclerosis, that could be a host of other conditions. ALS, for example, ALS was Lou Gehrig's disease, is actually usually diagnosed in absence of everything else. So they eliminate every other possible thing and then they call it ALS. But there's a host of demyelinating syndromes like AMN, adrenal neuropathy, ALD, dystrophy that look just like that. So a diagnosis is everything because, as an example, leukodystrophy is fats build up in the brain. So how do you eliminate those long chain fats or take enzymes to break down those long chain fats? ALS is caused by oxidative stress. Free radicals build up around the nerves and destroy the nerves. So in that case, antioxidants are the treatment. MS is autoimmune. The immune system attacks the nerves. And so they take immunomodulating agents or immunosuppressives. So it's really important to have a diagnosis, try to find out what's going on, and then we can attack it from there. Certainly, if it's neurological, the plus mind and vision will work and the cell defender will help. The plus mind and vision contains neurotransmitters directly that help improve nerve functions. The downstream implication of that, of course, is eyes and brain, but it helps with all nerve function. Okay, what's the best solution for high platelets? Oh, we got to figure out why you have high platelets. I don't like to treat symptoms. I like to try and find out what the underlying cause is. So there's lots of things that can raise platelet levels. Usually low serotonin levels raise platelets. So something that's reducing serotonin because the platelets secrete serotonin. So things if you're anxious, if you have anxiety, if you have something that's low serotonin, if you were on an SSRI type drug and went off it, because selective serotonin reuptake inhibitors like Prozac, they actually artificially raise serotonin levels, so you stop making platelets. When you go off those drugs, you tend to increase platelet production, which can actually be thrombolytic and dangerous. And so I ask people what's going on in their lives that could show high platelets. Certainly, cell defender, a cleaner, healthier body fixes itself. And then platelets are cardiovascular, so I'd look at plus cardio care. But Cindy, you really got to find out why you have high platelets. What else is going on? Okay. How should I continue the Aveni products during knee replacement recovery and prescribed pain reliever? Listen, none of our products are contraindicated with any of the pain relievers you might be taking. I would take the Plus Motion and I would use the Plus Relief oral spray and topical gel. So your oral spray for systemic inflammation, pain relief, and the topical gel on the knee. Okay. In addition to taking Plus Cardio, what else helps the person with atrial flutter? Again, start with cell defender because the cleaner, healthier body fixes itself. So that, and then if you have that atrial flutter, prolapse, then the plus cardio care should help. Depending on the severity of the atrial flutter, you might need surgery. If you have a valve that's sticking, as you get older, it's only going to get worse, even with supplementation. So a lot of people, depending on your age, will elect to have surgery to replace that valve. Take a look at it, see what it is. If you want to call me offhand, I don't know who that is, just as Nitafin or Nitafin. I can take a look at your blood work, your scans, and we can talk about what better advice I can give for that. My daughter suffers with poor circulation in her feet. When her feet get cold, she actually gets bruises. What do you recommend? All right, I definitely, how old's your daughter? How long has this been going on? Was there trauma involved? Usually, poor circulation in feet could be a symptom of diabetes or a claudication of the veins because of it. So we got to, again, try to figure out this is a symptom. What is the underlying cause? What's causing that? Certainly, plus cardio care is good for all cardiovascular function, circulation. It has a brevicapine, which improves circulation of the hands and feet. So that might help. But it could also be neurological. There's a condition called Raynaud's phenomenon, where when you get cold, say your hand, you put your hand in a freezer, it immediately turns purple. And that's not circulatory, that's neurologic. The nerves of the body tell the bloodstream to stop the blood to stop circulating to the hands, and the hand turns purple. So that's a neurologic condition, not a cardiovascular condition. So you got to try and figure out what's going on. So Tim, yeah, so you had Agent Orange. I thank you for your service. But yeah, that is a toxin. We've seen wonders in Vietnam vets utilizing the cell defender and the plus relief. So the cell defender to try and clean out whatever toxins are left, and then the plus relief as an anti-inflammatory helps a lot. We've gotten now over 1,000 veterans off of opiates using the plus relief. So I'm very proud of that statistic. And then, of course, if you have the heart challenge has damaged the heart muscle itself, the plus cardio care will help. COPD, now we're talking about lungs. Again, what is the underlying cause? COPD is it's a diagnosis, but it's a symptom of lung distress. What caused that lung distress? So it could be pulmonary fibrosis, it could be cancer, it could be cigarette smoking. And certainly, if they were a smoker, listen, I recommend Cell Defender for everybody. Every man, every woman, every child, every dog, every cat. Everyone should be taking Cell Defender, and it helps in everything. But it certainly helps in overt things like lung function. What hurts the lungs is toxins. They're toxins either from stuff you breathe in, particulate matter, or toxins from colonizing in the lungs. Because as people lose lung function, things start to grow in the lungs, especially the lower lungs, and that's where you get Pseudomonas and things like that. And so if they're in a nebulizer, you can actually nebulize the silver, which is interesting. The nano silver will kill everything. And especially if you're colonizing your lungs, you want to try and get things into your lungs. So they'll nebulize antibiotics. You can also nebulize the nano silver. And that works wonders in killing whatever is damaging the lungs over time. So yeah, so nano silver, cell defender, and then try to figure out what else is going on. Let's see. So neuropathy from chronic venous insufficiency from faulty valves. Okay, so you have claudications. Again, those claudications could have a cause. They're either genetic or they can be caused by diabetes. So just make sure your blood sugars are good. And then that's cardiovascular. If it's caused by venous insufficiency, that would be the plus cardio care. Final phase of heal my body, working with private physical therapy, my left pelvis to hip with major pain in the hip. Hannah, you had trauma, so wasn't Hannah the one that was hit by a car?
Yes.
Yeah, ACL reconstruct surgery. It's taking time. I'm now learning about hormones effect as a woman with menopause and hips and knees. Yeah, so she's asking about taking plus balance along with everything else. Absolutely. So it is true that especially as women get older, estrogen levels drop, testosterone levels drop, a lot of things start going wrong, and that includes bone resorption. So you're at much higher risk for osteopenia and osteoporosis. So I'd make sure you're getting a good form of calcium. To get calcium citrate, a calcium malate, an acidic form of calcium, you probably want to try and get 1,000 milligrams a day of a decent form of calcium. But the plus balance will help balance those hormones along, especially with your what you've been going through. It'll help balance the hormones, prevent excess hormone utilization, and prevent the buildup of xenoestrogens, synthetic hormones in the body. So that'll help a lot. So aside from the overt use of things like plus motion and plus relief, I think the plus balance will help a lot. So you've got it right. Hannah, I don't think I have anything to teach you. I saw the pictures. I saw how you've been bouncing back. It's been wonderful. Can cell defender help with drop foot? Okay, so again, it depends on the cause of the drop foot. So if people don't know, drop foot is when you take a step, instead of your foot staying straight, it drops and you drag. Okay, so you'll see people dragging their toes. So drop foot is caused by neurologic defect and while near degeneration. The number one cause of drop foot are multiple sclerosis, but there are even other autoimmune etiologies that cause drop foot. For example, Guillain-Barré syndrome, which is usually a side effect from certain vaccines, like the flu shot, can cause Guillain-Barré syndrome, which is autoimmune, which is usually self-limiting. It goes away pretty quickly or even within a few months. But people with Guillain-Barré syndrome can have long-term drop foot from that. That's neurological. I first of all try to figure out what caused it. Is it autoimmune? Is there those issues? Certainly, cell defender is immunomodulatory and certainly helps with autoimmune etiologies. But I'd also look at the plus mind and vision. Even though it's your foot, the plus mind and vision supplies neurotransmitters which help rebuild the nerves and everything. And then lastly, plus relief. The plus relief not only is anti-inflammatory and analgesic, but it does have things like nerve growth factors that help restore nerve function over time. So I tell the story about one of the first people that took our product was one of our investors in my biotech company. And he was in his late 60s and he had just chronic pain, bad back, and everything. And he was taking the plus relief for that. And he calls me crying because when he was 9 years old, he got hit in the face with a baseball and it shattered his orbital, shattered his cheek. And he had not felt his left cheek since he was 9 years old because of the nerve damage. And he started taking the plus relief for pain and inflammation, and he got feeling back in his cheek. So I think that's important because the reason he couldn't feel his cheek is because it was so overly enervated because of the trauma and the damage that his body shut it down. It's kind of like if you touch something that's so hot it feels cold or so cold it feels hot. You're over enervating those nerves and they don't know how to feel. So in this case, he didn't feel his cheek. When he started taking the plus relief, it dialed down those signals, and not only did pain and inflammation go away, but signals that were too low turned up, and he was able to feel his cheek again. So that could certainly help with things like neuropathies and drop foot. But again, Avini Vic, we got to find out why you have the drop foot, what the underlying cause was. I did COPD already. Macular degeneration, nothing changed on early eye exam after you're taking plus minus vision. You could double the dose of plus minus vision. So macular degeneration, again, we have to look because macular degeneration is always progressive. If it hasn't changed, that's actually a good thing. It hasn't progressed. Okay. So as bad as that sounds, not getting worse is getting better. All right. So especially in a progressive condition. So if you haven't gotten any worse while you're taking it, fabulous. Yes, you can increase the dose. It is the only thing I wouldn't more than double it. There are some components in plus mind vision, like the huperzine, that's an acetylcholinesterase inhibitor. You don't want to take tons and tons of that. Certainly, clinically, you could probably take 10 times a dose and not even scratch the surface of where it would be dangerous. But when I look at stuff like that, I usually take, you say you can double the dose. I wouldn't more than double the dose. All right. Let's see. Had a hamstring tendon transplant years ago. Repair ACL after injury. Been doing awesome for 28 years. Though somewhere I slammed knee into steel door frame while on a motorized scooter. Okay, so you shouldn't have done that. Whole room heard the hit. Did fine after a few weeks of rest. Winter came and now having issues, joint pain. It's not really. I'll use plus release and it came out. Began using plus motion. Not really helping. Any suggestions? Thanks, go Miami. Love Mendoza's from Miami. Okay. Thanks, Pat Tracy. Yeah. You have trauma from the knee. Yeah, you're doing everything right. I would take the plus motion as recommended. I'd use the plus relief gel directly on the spot and the plus relief oral spray. It's going to take time, especially when you have trauma like that. It's going to take time to heal. Certainly, you need the cold is hurting. It always hurts because cold shrinks everything. So you get people that I know people that can tell the weather. They know when the pressure drops when a rainstorm's coming because when the pressure drops, your body swells up because your body's always pushing out with 14.8 pounds per square inch of pressure. That's your normal pressure of your body at sea level. So when the pressure drops, when rain is coming, and you have a drop in pressure, these people feel it because they swell up a little bit against the outside pressure and they can feel it in their joints. So they say, oh, my knee's acting up, it's going to rain. That's actually a real thing. So yes, especially as it gets cold, as the pressure drops, you're going to have that pain. So Pat, we can talk offline about this, see what else you're doing, but you're doing it right. The plus motion, you might want to increase the plus motion a little bit, and then plus relief might want to increase the plus relief a little bit. It should help. How much anesthesia would you use a nebulizer? Just 2 or 3 sprays, and nebulizing dose is plenty. The whole idea is to get it into the lungs. It's not just systemic in the bloodstream. If it gets deep in the lungs, it can help with things like aspergillus infection. Dave, how soon do you put this recording out?
Real soon.
I say, what's the approximate count of particles of clinoptilizia in one drop? Okay, one drop is 10 milligrams.
I think you've said 200,000 per drop before.
Yeah, that's about right. But that's averaging about 1 micron or a little smaller than 1 micron. It could be 10 times that if we're down to 500 nanometers. So it's about 200,000 individual cages per drop at 1 micron. As we get smaller than 1 micron, it's going to be more. Okay.
Like the silver has about 1 trillion per drop, I understand.
Oh, it's 7 nanometers. It's a lot smaller. Yeah, the average silver particle is about 7 to 10 nanometers. We make sure that our clinoptilide zeolite is under 1 micron. That's our threshold. But our smallest particles are about 457 nanometers, about half of a micron. Still a lot bigger than the silver. Plus relief nerves, that the intern spray only or also when applied to the skin. No, so everything I'm talking about, the plus relief is both topical and oral. Of course, if you have deep neurological issues, systemic issues, you want to take the oral spray to get everywhere. I really recommend the topical gel when you have isolated areas of discomfort. And I usually recommend both. Even if you got a bad wrist and you're rubbing on your wrist, I still recommend the oral spray to take away the neural inflammation and to improve nerve function. What is the best for a person? Several arrive blockage was autocorrected. I think you're saying arteries, so arterial blockages. So that's atherosclerosis and arteriosclerosis. That's hardening the arteries and blockage of the arteries. Certainly, if it's really bad, then they're probably a candidate for bypass surgery. I can tell you this, that the components of Plus Cardio Care directly affect athero and arteriosclerosis. So you have components that help make the blood vessels more flexible, and so that helps with the hardening of the arteries. And then you have components like the absorbable palmitate, which is vitamin C attached to a long chain fat, palmitic acid. And so for the first time ever, you have this incredibly powerful vitamin C that not only is antioxidant, so prevents oxidative stress and oxidative damage, which can lead to altering of fats that go into the intima of the blood vessels, so it prevents that. But remember, vitamin C is a cofactor in the production of collagen, type 1 and type 3 collagen, that are necessary to build blood vessels. And so normally vitamin C is water soluble. What your body doesn't use, it excretes. Cerebral palmitate is fat soluble. So it stays in the body, gets stored, and it gets into places like the fatty plaques around the heart. So it's one of these great ingredients, one of my favorite dietary supplement ingredients, because it does so much. It gets to wherever it's got to go and has its function exactly at the site where it's necessary. So it's preventing inflammation, preventing oxidative stress at the site around the heart, and it's building new type 1, type 3 collagen to rebuild those blood vessels, to make them stronger, to make them more flexible, to prevent atherosclerosis and arteriosclerosis. And it's clinically proven to do. So definitely you need to be on the Plus Cardio Care. I think I got to the end. Oh, wait, the person with drop foot has MS. Okay, so I've been working with MS patients for over 30 years. My biotech company has a drug for multiple sclerosis, RPI 78M. We're in 2 phase 2 clinical studies in adults and children. We have orphan designation for pediatric MS. So I know pretty much what everyone knows about MS out there. It is autoimmune. The immune system attacks your nerves and demyelinates your nerves, strips the myelin sheath, the insulating sheath around the nerve, and so you lose nerve function over time. It's like stripping an electric wire, and the electric wire can no longer carry a charge. And our drug, RPI 78M for the treatment of MS, is a modified component of the active ingredient that's in the Plus Relief, the alpha cobratoxin. So if she's taking the Plus Relief, she's basically getting our MS drug, albeit much weaker, but she's getting that component of our drug for multiple sclerosis. So I would definitely say that the Plus Relief will help. She should use the oral spray and the topical gel. And depending on how she's treating her MS or how far along she is, she should keep tabs on us, keep looking up RPI-78M, and see our progress as we move our drug through clinical research. Okay, Dave, I got to the bottom.
Rik, thank you so much. I really appreciate all you do for us.
Yeah, it's only 12:07. I didn't go that long.
Thanks, everybody. Take care.
Thanks, Aaron. Go Canes.